Well, CDI was established back in 1981. We have 115 centers and 113 mobile units that are out there. We do approximately 1.2 million exams a year. Our goal at CDI, our number one goal at CDI is patient care. And to provide that, we look at multiple different aspects of it. And my part of it is the technology side. And how can I take my technology and provide the best patient care that's out there? If it's, turnaround time on images, getting the images to the right physician, having the right solution for the radiologist to view those images. We want to make sure when our patients walk in the door that they have the best patient care, from the technologist that greets them at the door to the back-end technology that they may not even see. Approximately 12 years ago, we had a failing archive. We were doing DAT storage. It was failing. We couldn't retrieve our images out of our archive. And so we partnered with Perceptive VNA at that time to come in and just do a disaster recovery, trying to get our images out, but then also look to create that infrastructure for us for our future and start planning how we were going to build off of our current platforms. I have a rural setting hospital that is a trauma center, and we had a patient up there that was in a car accident, and we needed to helicopter them down to the cities to receive their treatment. Because of the VNA, it allowed us to get that patient in the helicopter and on the way to the cities for treatment. Historically, what we would have had to do is wait for either to burn a CD or the 15 to 20 minutes to get a copy of the films, so the patient would be waiting in the emergency room. Instead, we were able to allow this patient to immediately be helicoptered down to the cities, and while they were in process and route down to the cities, we had the images already transmitted for the physicians to be able to continue that patient care with no delays to our patient, providing the best quality care that we could. The VNA plays a huge role at CDI. I mean, we're about taking images. It's about our patients coming in and being seen and us transmitting our images around. And without the VNA and the availability that we have with our images, our company would not continue to grow. I may have an orthopedic provider who actually put in his own MRI and does not have the capability or the knowledge to do the storage of the images. We offer, as part of doing the professional services for them, the ability for us to do the storage of their images and then to do their disaster recovery. So it's become a revenue base for us also. We've had the VNA for over 12 years. And what we're seeing as we're working with these new VNAs out there, that they're probably 5 years behind on where the functionality is on our VNA. I would highly, and I can say for my team, would highly recommend the Perceptive VNA. This has really allowed us to run our enterprise, have visibility into our enterprise, be proactive versus reactive on our systems, and it's really effectively allowed us to grow